Hello, everybody. Welcome to the Very Connected podcast. And so excited today we're being joined by Aimee Rothe. Aimee, say hello.
Hey everybody, how are you?
She's just an amazing gal. You guys are gonna love Aimee. She's actually joined me before on another podcast, so you may remember her from there. And today's topic is something I think a lot of people can relate to, and that's identity shock after weight loss, the mental side nobody warned you about. And we're going to be talking about, those rapid changes that occur after weight loss surgery and being more than just a number on the scale. Some people may feel disconnected after they have weight loss surgery, or maybe even just have weight loss, in general. So whether you're here as being a surgical weight loss patient or maybe a medical, we're going to talk about why identity shock may occur after weight loss surgery or weight loss and how it can affect behavior, confidence, and some strategies to support that. And just kind of tell you a little bit about Aimee. Aimee, oh my gosh, where do I even begin? Um, she serves as the program director of a metabolic and bariatric surgery program at a hospital system in Alabama. And as this role, she leads the Blue Cross Blue Shield distinction and MBSA QIP, Comprehensive Center of Excellence, all of those kind of strategies, along with being a healthcare provider. She's also a bariatric patient, and she began her own journey with lap band surgery in 2010, followed by a revision to a vertical sleeve in 2017. Along with living with the chronic disease of obesity firsthand, it helped to shape her work that she's doing now. And Aimee, I know you speak on a lot of these topics, not only just to patients, but also to the community as far as professionals as well. So looks like we have lots of people joining and saying hello. If you
Exciting.
are joining us, please put something in the chat box. Let us know where you're coming from and where you're at, whether you're on Zoom in the live event or on a replay, or you're joining us on Facebook. So at that, Aimee, I'm going to go ahead and allow you to tell us a little bit more about you. I know I kind of said just a little bit, but I know there's much more.
I, do you mind if I share my screen?
Yes, yes, please do.
All right. So, and if you're from Alabama, please put that in the chat box because I never see anybody else from Alabama. So today, I'm going to tell you a little bit about my story, but I kind of want to start out with why this topic is so important to me. I really feel strongly that we have to give patients the whole story after bariatric surgery. I feel like the patients are more successful when we talk about the good, the bad, and the ugly. I have walked this walk myself, and I'm always very transparent with my patients. So today's conversation kind of centers around identity shock. What identity shock is, and the reason we're discussing this is like Brenda said, that rapid weight loss, especially after surgery, really changes more than just that number on the scale. And we get so focused on that number on the scale. We go to class, we're prepared for our vitamins, we're prepared for protein, we're prepared for post-op visits and lab work and all these things, lose skin, we're prepared for that. But what I don't think that a lot of us are prepared for is that kind of emotional and mental side that occurs after surgery, kind of that, I call it the who am I now? Like, what is my identity? Who am I now? I have this discomfort about being seen. I have this shock of, I don't I recognize my body, but I don't really feel connected to it anymore. Just a disclaimer. My views are my own, not my employer's. And my goal tonight is not to diagnose anyone, and we are not labeling. My goal is to normalize this experience. I want to reduce the shame surrounding these feelings and kind of give us some language for what we can be feeling. A lot of patients tell me, something's not right. I don't know how to describe it to you, but something's just not right. Because when we name something, when we give something an actual normal definition, we can then work on it, right? And if we don't, we internalize it. We're like, I'm the only one. I'm the only one this is happening to. Something is really wrong with me. Another thing I do want to say is this is a very emotional topic. So this is a support group space. You do not have to share anything that you don't want to share. You can sit quietly and take what is useful to you, or you can participate as much as you are comfortable with. Just know that in this space, you're not too much in this space with me. So a little bit about my personal story. Um, like Brenda said, I'm a nurse. I've been a nurse 20 years, actually. I've been a nurse 20 years. And the majority of my career was spent in emergency medicine. And probably for around the last 6 years, I have been in the field of bariatrics and obesity medicine. I'm a board member on the state board of the American Society of Metabolic and Bariatric Surgery for Alabama. And I'm also a member of the Integrated Health, which is kind of the non-surgeon arm of ASMBS. Also, I'm on the board there. That's one side of my identity. The other side is that I'm a bariatric patient. I struggled with my disease probably longer than I can remember. I was overweight as a child. By the time I graduated high school, I was well over 200 pounds. I struggled from a young age with thyroid condition, polycystic ovarian syndrome, and I probably tried everything there is, probably twice, honestly. My own journey started with a lap band. Had a lap band in 2020 and later revised to a sleeve gastrectomy in 2017 at a weight of a little over 400 pounds. And so since that time, I've been on my own personal journey, and my chronic disease of obesity and my comorbidities of PCOS and hypothyroidism are in remission right now. But I still have the chronic disease of obesity. And I know that at any moment there can be a recurrence. I sit right at about 170 pounds now at a height of 5'7". Also, total transparency, I've undergone three separate skin removal surgeries. That has been a whole other arm of my journey that has been very challenging. And I share that because I'm not speaking about this only from the provider role. I know what it feels like to want to change desperately. Like all you want in life is to change. And then when that happens, you're like, whoa, okay, I still have a lot of emotional work to do. So we're going to dig in. Let's see. First, what is identity shock? It's such a very broad term. Identity shock is feeling disconnected from your new self. Okay. So you've had these rapid changes, and now you have a kind of a gap in between your physical body that's changing really rapidly, and your mind is kind of a little slower to catch up. And so patients will say, oh, I wanted this so badly. I wanted it. So why do I feel weird now? Why does this not feel like I thought it would? And what you need to know is identity shock is a normal adjustment response. There is not anything wrong with you. Your identity is not only your weight. It is not only the number on the scale. It is your routines. It's your coping strategies. It's your social roles. And so when that changes really quickly, your brain has to catch up. It has to kind of remap who you are. And so how major weight loss can trigger identity shock is your body kind of senses, ooh, this is a threat. Something is not quite right in my world. My brain is relearning my body map. And then, we've disrupted food coping, right? Everything has changed if you had that emotional relationship with food. And even that social feedback starts to change overnight. Our brain really likes familiar. And so, and even when that familiar was unhealthy, our brain likes familiar. So change can be very unsafe for us at first. So while we're having this conversation, and before we get into definitions and things like that, I do want to make you aware that we are all on the same page. Weight loss changes more than just your physical body. It changes your identity. It changes who you are. It changes what you're used to, what your normal is, what feels safe, how you take up space in this world, and even it changes what roles that you play in your relationships, romantic relationships, friend relationships, family relationships. So when someone loses a pretty significant amount of weight, those changes are not just physical. They really kind of get a little confusing and a little unexpected. So we're going to walk through a couple of common foundational areas on the next few slides that are recognized to contribute kind of that identity shock in that post-op patient. So starting with how you see yourself, right? Raise your hand if read these words on the screen. Raise your hand or give me a thumbs up on the screen, if you have ever had these thoughts, if you have ever thought, oh, okay, I still feel like the same person, but my body looks different. And I look in the mirror and it really does not match what I got going on inside. And really don't recognize myself. This is all very weird. When your body changes drastically, your mind is not updating that self-image. And so a lot of patients have these descriptors. They say these things. They say it just feels foreign. This is very common. Your brain holds a map of that body, and the identity can lag behind that change. Kind of, I always say we got to play catch up, right? And I also always say the surgery is the easy part. It's the mental homework that we have to do after. Sometimes seeing ourselves as different is very emotionally intense because at some point you're going to have to confront those old beliefs that you had carried for years, and those beliefs are comfortable, and kind of confronting them and changing them becomes very uncomfortable and very frustrating for a lot of patients. Another very common one, and this one really is it shocks people. It's like, okay, well, wow, how others treat me have changed. This is one of the biggest, why didn't you warn me about this situation type topic. After weight loss, you're getting more compliments, right? You're getting more attention. Even a different tone of voice from strangers, people opening the door for you. I always said, people are nice to me now. And that's a little disappointing, right? That someone treats you differently now than they would have at your previous weight. And sometimes you may even have people that feel resentful for their own reasons. They may be at a different place in their journey. And my personal favorites, people do tend to make comments about you like you're public property, right? You're everywhere you go, there somebody is commenting about your weight loss. Somebody is commenting about how you look different. Somebody is feels very comfortable about making your body public property. And that can be really confusing emotionally. Because on one hand, you're like, oh, this is positive attention. I should not feel weird about this. Someone's telling me, wow, you've lost a lot of weight. You look great. I should be like, wow, thank you. But instead, you're going, well, why didn't you think that before? Are people going to be nice to me now because I look different? And do I have to maintain this to get this love and respect from people? So even if it's positive attention, it can still feel really uncomfortable. And that can trigger a lot of anxiety because patients feel really exposed. They feel like they're being watched. They feel this pressure to, I always say, almost perform, be perfect. Everything's great. If you're on social media and you follow anyone that has had bariatric surgery on platforms like TikTok or Facebook or Instagram, you see the positives. You see everything's wonderful, everything's fabulous. That pressure to stay perfect, to never regain, to never mess up, to never falter, and that really can create a lot of instability. And how you feel safe in this world. So this one is actually really surprising to a lot of patients because when that weight comes off, patients feel visible. Someone who is not used to being visible, someone who is used to kind of being in the background, who is used to taking care of everyone else, now feels very vulnerable in those public places and really uncomfortable with kind of people looking at you. And if you've had a history of things like abuse, bullying, rejection, and trauma, that can be really uncomfortable. I always say being seen could be kind of danger. And this can lead to hyper awareness. This can lead to social anxiety. This can lead to avoidance. I had a patient tell me once, all I ever wanted was to be noticed. But now I hate being noticed. And that has stayed with me. And that was a few years ago. That has stayed with me for a very long time because that is absolutely how it is described. So then you kind of add in, okay, I cannot cope the way I used to because the way I used to cope was by emotional eating behaviors. Food was always there for me, right? And now it isn't. Now I'm in a situation to where that emotional coping has been yanked. It's been yanked out from underneath me. It was a comfort. It was a emotional regulation. It was a distraction, and we've lost that. And that kind of creates this really uncomfortable place too. Mood swings, anxiety, increase in depression, or actually having to go seek out other treatment for those feelings. And then, of course, I know that transfer addiction. Transfer addiction is very well known in our community. Transfer to alcohol, to drugs, to other things that produce that dopamine, gambling, exercise addiction, those kind of things. That's very common. It's not weakness. It absolutely is not weakness. It really is the brain doing what the brain does, which is searching for relief. Food was always there for me. Now it's not. What will be there for me? This one has always really interested me. The pressure to be fixed, right? I'm fixed. I'll never have this problem again. I should be totally happy. I will never struggle again. I made it. I should be confident now. And these are even statements that can come from coworkers, right? Why are you not happy? You're skinny. Why are you not happy? You had surgery. Why is your life not great? Sometimes, and that we say that to ourselves in our head. We're like, wait a minute. Why am I feeling these negative feelings? I should be happy. I'm ungrateful because I have these feelings. And that's a lot of pressure, right? People think they're being supportive, but that's a lot of pressure. If I don't feel amazing every day, I'm failing. If I struggle, I'm ungrateful. If I gain anything back, now I've failed. And so what happens is people stop being honest and they stop sharing those uncomfortable feelings. They stop sharing the feelings of anxiety, the disconnect, or stop confiding in people that they're overwhelmed because they're like, I should be fixed now. I'm supposed to be fixed. And so that's where that identity shock can intensify because we're not only adjusting to our new bodies, okay? We're adjusting to new bodies, new routines, vitamins, which are adjustment in themselves. We're adjusting to this whole new reality, but we're also adjusting to the weight of expectations of everyone around you, especially if you are open about your journey. Like I've always been very, very open about my surgery. I've never hidden it. I have patients who don't tell anyone, and I respect that. And their reasoning is because I just don't want to deal. I just don't want to deal with those expectations. And so then that shame causes avoidance. And then what we see is now we have patients that aren't coming for follow-up visits, right? They stop coming because they feel shame because they weren't perfect at one time. They stop coming to support groups because they no longer feel comfortable being vulnerable. They stop taking pictures. They stop going out to social events. Scale avoidance or hyperfixation with the scale, or hyperfixation with avoiding mirrors and things like that. Those are very common traits in post-ops that are experiencing identity shock. So avoidance can be a lot of things. It can be avoiding clothing shopping, staying in oversized clothes that you know are not working for you just because you don't want to deal with the situation. Withdrawing, isolating socially. Body distortion is very common in post-ops. Constantly, checking the mirror, getting on the scale multiple times a day, and allowing that number on the scale to dictate how they feel about themselves that day, comparing themselves to others, even others on the same journey you are, even somebody who may have had surgery at the same time you are, not understanding that we're very different in our journeys. And then going into that spiral, right, of either I'm completely fatigued and I'm shutting down. I had this conversation with a patient yesterday. She said, I'm so tired. I'm so tired of always being a bariatric patient, of it being on my mind 24/7 all the time. So you can have that fatigue kind of avoidance, or you can have that hyper control where you're making these really rigid food rules, or you're panicking over like really small weight fluctuations of a weight fluctuation of a pound, sends you into this spiral, which then sends you into some very disordered eating patterns. Fear of eating in public. I've had patients tell me, I don't really want to eat in front of people. I go to work. I don't want to eat in the break room because everybody knows I've had surgery and they look at me weird. And so all of this is very normal. If you're experiencing these things, you are definitely not the only one. And it definitely does not mean anything is wrong with you. We've kind of talked already about those emotionally numbing and transfer behaviors. if food was a coping tool, it's no longer available in that way. And so our brain's going to search for something. It's going to search for those other behaviors, those very risky behaviors. So we kind of discussed what identity shock is, what it looks like, what is contributing to it in our post-op bodies. So now let's talk about what's really important. I want to hit the most important part of today, like what helps. Because it does no good to talk about something if you don't talk about what helps. So it's not really something that you can, per se, think your way out of overnight. Okay. It's not something that has a quick solution. When your identity feels very unstable, we naturally want to fix it. A lot of us are fixers, right? We fix people, we fix everybody else. We take care of everybody else, sometimes sacrificing ourselves. So we want to fix it. We want that discomfort to stop. No one wants to live in discomfort. But what we have to take a step back and think is, okay, I got to build a stable foundation again. Almost like I have to re-identify myself and give my brain something solid to stand on. So we're going to go over 3 ways that you can do that. Most important, normalize it. Okay. Absolutely most powerful intervention. This is normal. This happens. I'm not weird. I am not losing my mind. So many patients think, what's wrong with me? Why do I feel like this? And we don't have words for it. So we assume that, okay, well, I, as the patient, I'm doing something wrong. Okay. It's me. I'm doing something wrong. If we normalize it, we remove the shame. Okay. And when that shame decreases, sometimes we become a little more willing to ask for help, right? We're willing to talk honestly, especially with your care team, to talk honestly, openly, candidly about what's going on and to stay connected instead of withdrawing. So we're normalizing it. Okay. We're normalizing it. Second, okay. And I will tell you, I'm probably one of the most blunt, honest people you'll ever meet. That comes from several years of emergency nursing. Bariatric surgery does not change it changes your stomach, does not change your brain. Okay. We do nothing to fix your brain. That's the hard work that occurs after surgery. It doesn't change your nervous system. It doesn't change your coping patterns, doesn't change your trauma history, doesn't automatically change your self-worth or that inner voice. Sometimes that inner voice is very mean to us. Those things need healing too. And a lot of times that healing it needs to happen after surgery. Therapy is not for broken people. Okay. We have to normalize mental health. We have to normalize that therapy is not a last resort. It is a frontline medical treatment for what's going on with us. It's for people that are doing something hard, right? And we are definitely doing something hard. I think we all agree that there's nothing easy about this journey. And of course, support groups. I realize that is very cliche. Everybody's like, oh, support group. The feeling being surrounded by other people when you say, I am having this problem, I'm the only one. And 20 other people go, no, girl, you're not. No, you're not. I had the same issue. I'm going through it too. We can normalize it together. They fix one of the biggest causes of identity shock, which is isolation, right? Because when I'm surrounded by others that have gone through the same thing, I'm not isolating myself. When we isolate, it becomes really easy for us to slide back into those old coping mechanisms and kind of disengage from our routines. I call it just complete fatigue. And it makes you feel like nobody understands. Nobody understands this journey that I am on. I always say it's a very powerful message. Support groups are. It's this powerful message that I am not the only one. And the third is identity anchors. We have to intentionally build a new identity that is not only about weight. And that is hard when you have had that identity your entire life. When your identity your entire life has been, I struggle with my weight, that's your identity anchor at that time. So it kind of answers, I guess you say, who am I now? Okay. So who am I now? Am I now someone that shows up even when it's uncomfortable? Am I someone that chooses my own health? Am I someone that is learning this new relationship with my body, or is actually for the first time in my life putting myself first and keeping promises to myself? So creating those new identity anchors that aren't specifically, okay, my identity is, I always said, I was the big girl. I was the big girl with the mustache and the one eyebrow. Okay, because I had PCOS. Okay. I know that was funny. If you're another girl on here with PCOS, you know what I'm talking about, okay? You know what I'm talking about with the mustache and the eyebrows. So serious red flags. This is my nurse side coming out. I want to spend a minute here because this side is about safety and it's about getting support early. One thing that I tell my patients is don't wait until you are 5, 6, 7 years post-op and you self-destruct before you say, okay, maybe I need to get some help. Because at that point it's unbearable. And so we know these very intense emotions are very common. And yes, we absolutely expect some hormone shifts, some mood changes, some body changes, and the fact that your primary coping tools have changed. But there is a big difference in normal adjustment situations and a situation to which it's now time to bring in emotional support. If you have noticed these symptoms becoming more and more intense, especially lasting longer than a few weeks, if they're getting worse instead of getting better, increased anxiety that's now impacting your daily life. So it's impacting your routines, it's impacting your ability to function. You know, you're not per se overreacting. You your nervous system is it's kind of overwhelmed. It's very overwhelmed and it needs a little assistance. If you start to notice disordered eating patterns, the best thing I can tell you is to circle back with your team. That's what we're here for. We're not just here to put you on a scale and tell you to go take your vitamins and drink your water and eat your protein. We are here for the good, bad, the ugly, the emotional side, the physical side, and your bariatric team should be your biggest cheerleaders. We want you. We want you to succeed. We want to help you treat this condition. And those behaviors returning could be anything from grazing behaviors or like this constant feeling of being out of control around food, all the way up to something that is really extreme, like binge eating behaviors, intentional restriction, things like laxative abuse or forced vomiting, those kind of things. Fear of food becomes common. It's something we see often. Fear of food and fear of the scale, like fear, this extreme fear of getting where you were prior to surgery that then becomes irrational. In your mind, you're like, the rational side says there's no way. The irrational side says if I eat one more potato chip, I'm going to wake up in the morning and be back where I was. And we it's a hard battle to fight your irrational side. Sometimes we transfer those coping behaviors. We kind of already talked about that. So if you notice that you're drinking, if you notice that you're doing things that probably need some intervention, please reach out to your team early. We know there's a little over 30% incidence of transfer addiction after surgery. So we know it's there and we know it's a possibility. Any kind of those risky behaviors. And then that obsessive body checking or distortion. Those are all things that should be immediate red flags and say, hey, yeah, I need some help. I need to get some help on this journey and I need to get some help really soon. I'm going to open it up for some discussion. So as we open up this conversation for discussion, I want to close with this. If you have had surgery or even not, if you've taken medications, if you've lost weight and you thought, okay, I should only feel happiness, but instead you feel weird. Instead you feel these uncomfortable feelings or feel disconnected. You are not doing anything wrong. You are not failing. You are not broken. You are adjusting to a major life change and your brain and your identity take time to catch up. So one closing piece of advice I will say is give yourself some grace in this journey and allow yourself to kind of live in those emotions so that you can work through them. I'll open it up for discussion. My Instagram, so I'm not an influencer. Okay, I'm 40 years old. I'm not an influencer. I'm a post-op that's chronicled her journey off and on since 2017. So I do have an Instagram, not very exciting, but if you would like to connect, it is there. Do we have any questions in the chat box?
Actually, there's a few, and there's some in our Q&A box. Let me jump to two that were in the chat feature, and then we'll go to the Q&A. And if by chance we have anybody on Facebook as well, and they'd like to have a question or something they'd like to do, please comment there as well. So one of the things Jenny brought up is she said many around her are using the shots, kind of like the GLP-1s, I'm assuming, she's had surgery, and she said now she's seeing them have success, but she's stuck. And she said she's more than a year post-op. She's 16 months out. She's been stuck, she said, for about a year. So any suggestions, Aimee, that you have for somebody like that? And I think that kind of gives us with that identity too. Stuckness is an identity.
It is plateaus and stuck. This is what I will say. So transparency. I am a huge supporter of GLP-1s and obesity medicine. This is what I like to say. We have tools in our toolbox to treat our chronic condition because that's what obesity is. It's a chronic condition. It's progressive. It's relapsing. And so there are different tools. I encourage you to not get cornered into, okay, I've had bariatric surgery. There are no other tools. Because if I had high blood pressure, you prescribe me a blood pressure med, it works for a while, then it stops working. What do? Do I say, okay, there are no other tools out there? Or do I say, wait, there are other tools in the form of medications? I am a huge proponent of GLP-1 use after bariatric surgery. If your insurance covers it, and it's something you can look into. If you have not seen your surgeon in a while, if you are having those plateaus or those feelings of being stuck, cycle back around with them. There are a lot of programs that have in-house dietitians. They have, like we have a back on track program that works with, I won't take anybody in it under 2 years. So there are options there. We have to remember this is a full toolbox. We are treating a chronic condition. It is not a one or done type situation. We will live with this our entire lives. And so it is completely acceptable to even go back on GLP-1s or think of other things after surgery.
Aimee, I'm glad you brought that up because I know for myself, like I had weight loss surgery too as well. Probably many on this call are aware of that, but I had it back in 2013 and I did have some weight regain. And I think getting back, um, the last 2 years have been kind of a back on track for me in actually losing that weight back. So it can be done no matter how far out you are. For me, I did use some of the GLP-1s. I also think though it was a combination of a bunch of different things. It was, getting my nutrition back, talking to a fitness coach, like the places that I really needed help that I wasn't reaching out before. Um, making sure my mindset's in the right place. For me, that's listening to podcasts, listening to support groups. It's about being in the right communities. So I feel like each person is different and individual what they may need. So I would say just reach out and get help from your bariatric program, like Aimee said, or those other places that you might be able to get supported. Sarah says she was having emotional today. She said she had a hard conversation and the support she was feeling like the support wasn't there. My thinking is sometimes people just can't support you and because they're not in a good place themselves. So
Yep.
Aimee, what would you say on that?
Relationships are tricky. And I don't mean like romantic relationships, but the social aspect of it. I think that's what I spoke on the last time I was here. The social circles surrounding bariatric surgery. Um, there are different reasons why people are not supportive. It can be the fact that some people are just mean. It can be that they are fighting their own battle, that is giving them some really uncomfortable feelings. There are feelings of jealousy if they see someone else being successful. There's fear. I have a lot of patients say, my friends keep telling me I knew somebody who had surgery and they were all messed up, right? After surgery. And sometimes it comes from a place that's not necessarily, you know, completely negative. I kind of learned a long time ago that we cannot force anyone to change or be supportive of us. And at that point, you have to kind of make the decision, okay, is this a healthy situation? Is this person healthy for me in my life? And sometimes we have to make those decisions where we go, hey, you know what? I'm done being a pushover. How about this? I'm done being a pushover. I realized for years that I have let you do whatever it is, that I have tried to please you. But today I'm going to fill my cup. Today I'm going to take care of me. I'm going to put myself first. And just remember that you can't force everyone to be on board with this. There's so much stigma.
Yeah, for sure. There's a lot of questions about support, like people trying to find support in different places. So Aimee, the ones that's been mentioned here, we have Berry Connected, which is this
Yes.
forum, which thank you guys for joining us. We appreciate you, Berry Nation, and actually this is being live streamed into the Berry Nation
Love Fairy Nation.
platform.
Yes.
So we're definitely a supporter of that. It looks like some of the other vitamin companies
Mhm.
have support groups. Also, a lot of times bariatric programs, Aimee, the one that you work for there in Alabama, I'm sure, do they have a support group as well?
We do. We have a support group. Reach out to me. My support group's open to everybody. I will tell you, if your bariatric program is a center of excellence, which kind of it should be hard to find out that information. You can actually you can type in bariatric centers of excellence in Google, and it pulls up a drop down box where you can search. So if your hospital surgery center is a center of excellence, they actually are required to have some access to support groups. Most of us, I can speak for the two programs that I have managed, have internal support groups that are like mine is run by myself and my dietitian. I have guest speakers and things like that. So just reach out to your surgeon too and say, hey, what resources? I do know if you have a language barrier, I don't know if anybody is on the call that has a little bit of a language barrier or is Spanish speaking. Assessment and Therapy Associates has a specific support group pathway for Spanish speaking patients, which has been very valuable. So very valuable because that was an area that was lacking. I'm trying to think of who else. There are support groups on Facebook. There are support groups on social media. I do maintain a lot of caution with those. I would encourage you um, to just maybe not listen to everything on there because as both a provider and a patient, sometimes it makes me twitch. But if find a buddy, find someone that's had surgery same time you have. Type in the chat box right now. Hey, my name is Sally. I'm from Georgia. Anybody else from Georgia that wants to connect and find a buddy. And if you like I said, if you want to reach out to me on Instagram, I can connect you with my program support group also.
Do you know of any that have like a chat feature? I know Berry Nation does do that. Jenny's asking, she said, these are great, but I like something along the lines of a chat group. So I would say there actually are a couple that I can think of that are more of a chat feature. Facebook groups sometimes are, depending on the group, can be helpful as well. Berry Connected, if you look up ours, we do have a Facebook group that's more of a chat back and forth. Any other
And
suggestions?
your program may have one. We have along with our like my actual support groups that meet virtually and in person every month, but we actually have a private Facebook support group that is just for our patients. It's locked down for patient privacy, and patients are in there constantly bouncing ideas off each other. So you actually never know what your facility may have unless you ask. There may be something. I know that when I had my surgery back in 2017, there was nobody had Facebook support groups. You were kind of on your own, except for that one time a month you went and sat and talked about vitamins or clothes swapping. And so there are so many resources out there now. You may have a surgeon's office with a Facebook group. Dr. What's her name? Dr. Dovak, Dr. Betsy Dovak. She has a pretty large Facebook support group. So get in touch with your program. Every program that's a center of excellence should have a program director, usually a nurse or a dietitian in that role, like me. Get in touch with them and say, "Hey, do you have resources?"
It looks like too, great suggestions by the way, Amy. It looks like we have some questions coming in from the Q&A feature. So I'm going to read some of those. The first one says here, it's from Rhonda. What is the timeline of skin reduction? Should you wait a year or when you feel overwhelmed with the extra skin?
I waited. Okay, so general rule. You got medical Amy over here. You need to be stable nutritionally. It is the worst thing you can do to undergo a major skin removal surgery with poor nutrition. You will not heal well. It will be a absolute and total disaster, and you will not be happy. I also say be as close to the weight that you want to be. Unless the skin has gotten to the point where now it is truly causing some horrific medical issues, because there, you think that the journey after bariatric surgery is heavy. The journey after skin removal and reconstruction was probably more mentally challenging. You're swollen, you're miserable, you feel it's a lot. It's a lot. So I always say, I tell my patients at least 24 months post-op, preferably stable management of your nutrition, compliant with your vitamins, good labs, mentally in a good place, and then just go get some consults. I had mine, let's see, I had my surgery in 2017. I actually had my arms done in 20, I had my arms done in 2019. They were causing me some major issues. I had my first fleur-de-lis abdominoplasty in 2020, my second one in 2024, and a breast lift too, because I had some complications in 2024. So I waited a while.
Thanks for sharing that, Amy. I know that that's personal too.
I won't
Also,
open up. I'll show my scars and everything. I'm an open book at this point.
Rhonda also asked, after a year out from surgery, I have lost 100 pounds, but I am having a hard time rejoicing lately. Should I reach out to my, thinking she's saying psychologist?
You absolutely should. If you are feeling dysphoria, if you're in a place that feels heavy and uncomfortable, that's a that's an indicator of identity shock. I would reach out.
Okay, great suggestion. Um, what advice do you have for someone who's not had surgery yet?
Ooh, I the single piece of advice that I would give to someone who has not had surgery yet: do not wait until after surgery to work on the mental health aspect. Start now. 100%, 1,000%.
So would you say seeing like a therapist or a
Mhm.
coach, life coach or somebody like that to help you with that?
A therapist, and I would search one that is used to bariatric patients. I don't want to push companies, but there are a lot out there that actually specifically work with those who are preparing or have had bariatric surgery, and so they get it. They know what to look for, and they kind of know what path to go down. That they know what we experience as post-ops. So I would make sure that if you do reach out to a therapist, a psychologist, that you ask that question. What's your experience with someone who has had a major weight loss?
Do you think people should change their goals if they are at a plateau? Is another question.
I don't think goals should ever stay stagnant. So that's kind of one of those questions. I think that we should always be changing our goals. I'm a big fan of SMART goals, short-term SMART goals. So they should be specific. It shouldn't be this vague kind of goal. They should be measurable. I think one thing that I see is people will set goals with no way to actually say, okay, I've achieved it. It should be forgiving and actually attainable. If your goal is, I'm going to get to 120 pounds and stay there forever, is that truly attainable? Is that forgiving? And then it needs to be measurable and short term. So I kind of feel like your goals should always change, especially if you've got a plateau. Yes, absolutely. Start to reflect and look at what you got going on and start to make short term goals that you can then measure. Okay, this month, you know what? I tracked my food 5 out of 7 days this month. Met goal. I can either move on to the next or I can now elaborate on
I have somebody asking on Facebook. It's Robin. She says that she had surgery in 2001, leg lift in 2003. Do you think it's too late at 63? More surgery. I'm thinking that she's talking about plastics.
You are never too old to feel good about yourself. So the answer is no. If you are in good physical condition and if you're, if in, you know, when you go looking for a plastic surgeon, please make sure that you do your research about body contouring and someone who actually is familiar with it. But you're never too old. You're never too old to take your life back and feel good about yourself. Absolutely. And you've already done the worst one. You've done a leg lift. That's the major one.
Yeah, yeah, for sure. Okay, let's see. Kinsey says, will working out actually help with skin tightening post-op, or does that only work for so far before you need skin removal?
You will never be able, if you have adipose tissue combined with aging and skin laxicity, that's an almost impossible goal to think that I will be able to tighten that just by strength training. Does it help? Absolutely. It absolutely helps. But the skin is skin, and it becomes very lax after years of being stretched. So it usually will not completely snap back. If you're younger, not a smoker. Sometimes those patients, my male patients, tend to have a little bit less loose skin sometimes in their arms and legs, but a lot of times you're going to have some sort of remnants of laxicity.
Hey. Well, guys, right now it looks like we've kind of covered, it looks like most of our questions have been kind of answered. Aimee, I'm gonna go ahead and share again in the chat
Mhm.
feature
Yes.
your Instagram once more in case they would like to get a hold of you. And then also, if it's okay, I'm going to share a little bit about our sponsor too here as well. Um, ProCare. Do you have any closing thoughts before I do that though?
Um, can I give a shout out for the chocolate calcium bars?
Oh, heck yeah.
They only come around every once in a while, guys. Okay. If you have not had the chocolate calcium citrate, you are missing out on life. You just got to be careful that you don't overdo your dosage because they are so good. So when they come out, what time? It's what, the winter months when you guys do it. They're so
It
good.
is, yes. And actually they started coming out this year because it got cooler, I think around October-ish. I think we started carrying them again. And we are still carrying them. We'll be carrying them probably until I'm gonna say maybe March, April, depending on when it starts getting warm again. So we usually just carry
They
them whenever it's cool.
are so good. They taste like a Hershey bar. They do. They taste like a dark chocolate bar. And I totally don't get paid by ProCare, but I love them.
I was sharing on our Instagram or on our Facebook page your how to find you too there. So yes, okay. Well, guys, I'm going to share my screen for just a hot second. just to kind of show, and we do have ProCare is our sponsor, and I do want to show appreciation for them for allowing me and Aimee and all of you to come together to share this space. Um, right now, in order to find ProCare, you can go to their website directly, and it's procarenow.com. Again, procarenow.com. On the website, you'll see the ProCare logo, and then you will also see a little blue bar. If you have never tried ProCare and you'd like to try them, we do have free samples on our website. There's a little bar at the top. It says interested in a free sample. Click here. Right now, today's date is the 13th of January of 2026, and we have a buy two, get one free ProCare Essentials. The calcium dark chocolate that Aimee just talked about are on that special. Thanks, Aimee, for the promotion on that. So it is actually, so basically on the page, you just pick which products that you want. And so you buy two, you get one free. That's exciting. And the code is choose you. So we also have some new other products that we haven't really talked much about yet. And that's our protein powder, which is unflavored, 19 grams of protein, and our creatine powder. So depending on where you are, if you're looking for something that's unflavored and unsweetened for protein powders, like to mix into maybe some of your drinks or maybe even food, because sometimes it can be like yogurts and um, puddings, cottage cheeses, different things like that. It can be a great little way to get some extra protein. And I'm also just going to mention on the same page here, there's a little survey that you can do. It's called Build Your Routine. And basically, if you're looking to find out what products might resonate best for you, depending on your surgery type or where you are on your weight loss journey, definitely like a little way to be able to kind of go through a short little quiz that asks you some questions and can kind of help pinpoint some different areas for you as far as products. We did just come out with loyalty rewards. So whenever you do purchase something, you do get rewards for that. I'm going to also just jump over here to our resources tab. On our ProCare page, under resources is a tab that says Very Connected, and Aimee's, her event from today is actually on there. So if you're listening, you've probably already registered. You should have gotten a link. If you decide you'd like to come back and listen again, I do that a lot with some of these support groups because sometimes it just doesn't always, you can't always feel all of it and get all
Yeah.
the information in one call. Yeah. So come back, listen to us again. You can either register again or just go back to the link that was sent to you in an email. We also have previous events that's on there. The last few are actually you can short links where you can just kind of navigate onto there. We also have below that on that same page our link to our YouTube channel, our Facebook page, our Facebook community. So we were talking about communities. Those are great places to kind of meet for extra support. On our YouTube channel, we actually have, it's called ProCare Health Vitamins and Supplements. And if you subscribe, there should be a subscribe button. You can actually watch, we have over 500 videos on there now, so all different kinds. And actually, you can probably even type in the little search queue under ours, Aimee's name, Aimee Rothe, and should pop up, should, maybe I type in Aimee. Yep.
Was it January of
Uh,
last? Yep, there it is.
Yep, it was last year, 11 months ago, it says. So, navigating the ongoing changes in social relationships and dynamics after weight loss surgery, which is always a huge topic, not talked about quite enough, and actually kind of brought into today's conversation, a lot about the social and relationship dynamics. So, great little topic. Go back and you can always click onto that, subscribe to our channel and look and watch that as well. And then really, whoops, as far as anything else, I'm gonna go ahead and stop sharing my screen and just thank you, Aimee, for being with us here today. I know you
Very
had to
well.
take time out of your schedule, seeing patients and all of that, and just want to appreciate you being here. I'm looking to see if there's any other comments. I don't see anything else. It looks like, what do you take, Aimee, as far as being a post-surgical weight loss patient,
Um,
as far as vitamins and stuff?
so I take a bariatric multi with 45 of iron. I take calcium citrate. Make sure it's calcium citrate and not calcium carbonate. And I take a B12 injection once a month.
Okay. And that probably hits the recommendations pretty
Yes.
thoroughly.
Yes. But just remember, you can't take your multi and your calcium at the same time. That's that's one of the biggest sticking points. If you take them at the same time, your iron eats your calcium because they don't like each other.
Thanks for the reminder, because sometimes I don't think people know that. When we first go through these steps, the programs that are good
Mm-hmm.
programs like your programs probably give a lot of education and things like that and give like a book of information. But the problem is you have so much that
Yeah.
you're learning those first few months during the
It's like
process of
drinking from a
becoming a
fire hose.
surgery.
I say it's drinking from a fire hose at a time where you're already so overwhelmed because number one, you've probably gone through the insurance process and dealing with your insurance company, and that's stressful. And then it's probably slapped you in the face that this is really happening. And then some lady like me is sitting here feeding you information. It's like drinking from a fire hose. And so I always say you are never too post-op to learn.
Yeah. And seeing what actually, and I'm kind of like you, Amy, I kind of take some of the same type of supplements. I take my I take calcium, and I actually take extra of the
Mhm.
ADEK. Um, Sometimes I take fish oil, sometimes I take
Mhm.
biotin, magnesium, I don't know, just a little bit of depending on where I'm at, but usually always the multi and the calcium. So, but that ends our conversation for today. So thank you so much, everybody listening. Have a wonderful day.
You
And
guys have a great afternoon.
absolutely. Thank you, Amy. Everybody, let's stay very connected and have a great, great day. Bye bye.
Bye.